Case 13, 2018. A 53-year-old man with cardiomyopathy and recurrent ventricular tachycardia. For María Belén Vera González. Definition: a 53-year-old man presented with shock and ventricular tachycardia, cardiac MRI revealed an ejection fraction of 43%, with septal hypokinesis, myocardial edema, and late gadolinium enhancement of the subendocardium. Diagnosis tests were performed.
Your heart is a muscular organ which lies in the center of your chest. Your heartbeat is controlled by electrical impulses, which travel across the heart, making it contract. The atria contract first, sending blood into the ventricles. The ventricles then contract, sending blood to the lungs and around the body. Nerves supplying the heart change the rate at which impulses are sent across the heart muscle to meet the needs of the body. In ventricular tachycardia, abnormal electrical impulses are produced in the lower chambers of the heart. This causes the heart to pump faster than normal. The ventricles may not have enough time to fill up with blood properly, so less blood is pumped around your body.
Application in medicine. The author described that the involvement of the right ventricular side at the basal ventricular septum is specific for cardiac sarcoidosis but was absent in this case, but the right ventricular dilatation with an ejection fraction of 36% and a significant thinning of the interventricular septum were recognized in this 53-year-old male patient presenting with recurrent ventricular tachycardia after defibrillator placement for non-ischemic cardiomyopathy. Notably, only 20% patients with cardiac sarcoidosis show non-caseous epithelioid cell granulomas in the pathological examinations of the endomyocardial biopsy. That is why it seems difficult to rightly rule out cardiac sarcoidosis despite the presence of myocytic necrosis in the specimen, which is relatively specific to giant cell myocarditis cells. Thus, it is useful to measure the serum angiotensin converting enzyme ACE and reaction PCR as supportive grounds to rule out the possibility of sarcoidosis.
When your heart's not beating properly and the blood isn't getting to your body and you don't feel good. And that's explained a lot of why I don't feel good. And I was laying down and I don't sit down. So for me to lay down periodically a lot throughout the day was not me at all. And then I'd lay down at night and my heart would completely misfire. And I didn't know what to do. I'm only 52. I didn't know what to do about it.
Arlene's rhythm has been a challenge for her. It has been troubling her for years. She had an abnormal rhythm coming from the bottom chamber of the heart. She had what we call ventricular tachycardia and ventricular extra beats, which mean basically rhythm disturbances or extra beats coming from the bottom chamber of the heart. So Arlene underwent a couple of ablations because her rhythm is very complex, and she did very well.
I am alive. I can move, I'm off the couch, I am myself again.
First, the resonance helped more specifically to obtain accurate data of the disease. Because of the 53-year-old man's illness, he had to help many people with the same disease throughout medical analysis.
My name is Katie. I had ventricular tachycardia when I was 23. Fit and healthy, and it wasn't necessarily my focus to always be super healthy, but I was, making the right choices. And so signed up to a new gym and a new doctor's surgery. And when I was there, a nurse who was checking my blood pressure said, have you just jogged here? And I said, no. And she said, oh, this is weird. Your resting heart rate is 145 beats per minute, but it should be 60 to 80. Do you have fast heart rate a lot? I said for years, it's always been quite fast, but I've never paid attention to it. I called my parents and said I'm in the hospital and I'm not sure what the problem is, but I'm in the resuscitation room. I think it might be serious. I was absolutely exhausted. I was glad to see mum and dad, and they needed to keep me in overnight. We found that it was a drug that was used to lower my heart. As soon as it went in, my heart rate just went down to a more normal rate. And they taught me how to check my pulse and asked me to do that kind of 3 times a day. I said maybe I should go back to the doctors about this because it shouldn't be this fast. And the beat should be da-dum, da-dum from the atrium to the ventricle. And mine was just kind of going at double speed. It had 2 different kind of pulses going at the same time. Because of that, the heart as a muscle was just wearing itself out. When they go up through the artery, they have to locate where the stray electrical activity is, and they burn that off, they ablate it. When I was awake on the bed, induced a heart attack. I think I always maybe thought, you see heart attacks on TV and you think, oh, it probably feels like a bad heartburn, but it wasn't. It was like an elephant sitting on your chest, and then both my arms just went numb, and it was really painful. But after a few weeks, it kind of slowed down, and it just became so much stronger. I felt quite alone with it at times because I didn't know anybody else who had been through anything similar, who had anything similar. When it's a heart, you think maybe you've got to be a man who's middle-aged to have a heart condition, and it's just absolutely not the case. I tell people not to hesitate to kind of seek counselling, talk to their loved ones, their work, their friends, and kind of explain not only what the condition is and how it affects them, but possibly how it affects how they feel. It did surprise me that I could go through that and come out the other side and be good. You don't know until you've gone through it. I think you can look back and say, that was amazing.
Cons: the disease, if you do not get it diagnosis on time, takes you to death. Sarcoidosis may occur in the patient. Issue applied in Ecuador. Most patients with hypertrophic cardiomyopathy remain asymptomatic until they are 20 or 13 years old. From this age, symptoms begin to appear progressive, and by the age of 40, 50, most patients who survive are symptomatic to a greater or lesser degree. As of this moment, deterioration begins faster. Uh, 51% of these are sudden. Patients who are diagnosed when children or young people were generally asymptomatic, and those with an unfavorable family history have an annual mortality of 5.9%. Syncope at the time of diagnosis is also associated with poor prognosis, with an annual mortality of 2.5%. The average duration of symptoms before death is usually about 10 years after the fourth decade of life. Mortality due to earth failure increases above all from the appearance of atrial fibrillation. Conclusion: sustained ventricular tachycardia is an important cause of morbidity and sudden death in patients with dilated cardiomyopathy, although ICD effectively terminates VT episodes and improve survival. Shocks reduce quality of life, and episodes of VT predict increased risks of heart failure and despite the effective therapy. Patients suffering recurrent VT episodes remain a challenge. Antiarrhythmic therapy reduces VT episodes but is associated with serious adverse events and disappointing efficacy. Catheter ablation has emerged as an important option to control recurrent VT, with major previous-related complications and even death are still issues to consider, and even with this armamentarium, some patients still have recurrent VT episodes and ICD shocks. We report on patients with non-ischemic dilated cardiomyopathy and recurrent ventricular tachycardia resistant to multiple antiarrhythmic agents in one run was effective, completed surprising ventricular tachycardia episodes.
What is cardiomyopathy? Cardiomyopathy is an abnormality of heart muscle that may lead to heart failure. On the board, I've shown 4 examples of the left ventricle of hearts. On the top right is a normal heart, showing normal wall thickness and normal cavity size. Compare this with the most common type of cardiomyopathy called dilated cardiomyopathy. The heart is enlarged, the chamber size is increased, and the walls are thin. The cause of this type frequently is unknown, but may be related to other things such as alcohol abuse. Below that is hypertrophic cardiomyopathy. This is characterized by very thick heart muscle, a tiny left ventricular cavity size. This may be inherited from a parent and may be treated in some cases surgically. The rarest type of cardiomyopathy is the restrictive, and this is usually caused by a substance infiltrating the heart muscle itself. Once this type of cardiomyopathy is suspected, further workup is often necessary.
Thank you.